A hernia is a body part that protrudes through an abnormal opening or weak point of the organ that usually confines it. They can be congenital or acquired. The surgical repair method and additional characteristics are used by coders to report the appropriate CAPTAN code. Key items to search for in documentation. The aim of every hernia repair procedure is to manipulate the herniated organ back into its proper position. Surgeons may implant mesh or other prostheses to provide support and prevent future herniation. Hernia repair without mesh or an implant is known as herniorrhaphy. Hernia repair with application of an implant or mesh is known as hernioplasty. Repair methods depend on the type of hernia. For appropriate code assignment, the coder should search physician documentation for age of the patient, presentation, reducible, incarcerated, or strangulated, episode of care, initial or recurrent, length of defect, e.g., less than 3 cm, 3 cm to 10 cm. Location, e.g., hiatal, inguinal, femoral, abdominal, peristomal. Surgical approach, e.g., open, laparoscopic, robotic. The categorization of hernias as initial or recurrent is based on whether it has required previous repair or not, according to the AMA's CAPTAN section guidelines. Assessing complexity. Many CAPTAN hernia repair codes include descriptions of the hernia's complexity, as it influences the difficulty and severity of the procedure. The presentation's descriptions are as follows. Reducible. The hernia can heal by itself or a medical professional can physically manipulate the herniated body part back into its original place. Incarcerated. The herniated body part cannot be manipulated back into place. Strangulated. The herniated body part cannot be put back into its original place and has compromised circulation. Diaphragmatic hernias, otherwise known as hiatal hernias, occur when the stomach's fundus pushes through the esophageal hiatus, or the natural opening in the diaphragm where the esophagus resides. Diaphragmatic hernias can be further categorized into 2 types, sliding hiatal hernia and paraesophageal hiatal hernia. Surgeons can conduct a hiatal hernia repair via laparotomy, thoracotomy, thoraco-abdominal, or robotic incision. The repair involves the surgeon gently pulling the top of the stomach down through the esophageal hiatus so it rests in its proper position. Sometimes, surgeons reconstruct an esophageal sphincter or shrink the hiatus to prevent the stomach from being pushed back up again. Additionally, surgeons can perform hiatal hernia repair with or without fundoplication and/or mesh implantation. Fundoplication, otherwise known as fundoplasty, is a tightening of that lower esophageal sphincter where the esophagus meets the stomach to reinforce not only the repair of the diaphragm, but to reinforce that connection point, Safian explains. Fundoplication is the process in which the surgeon wraps the fundus of the stomach around the base of the esophagus. He or she secures the stomach in place with stitches, preventing it from distending through the esophageal hiatus again. CPT coding and documentation. Diaphragmatic hiatal hernia repair codes are located in several sections in the CPT manual. 39503-39541. For chronic, acute, traumatic diaphragmatic hernia repair in neonatal and non-neonatal patients. 43280-43282. Laparoscopic repair of paraesophageal hernia, includes fundoplasty, with and without mesh or implant. 43332-43337. Paraesophageal hiatal hernia repair, including fundoplication, via laparotomy, thoracotomy, or thoraco-abdominal incision with and without mesh or implant. CPT parenthetical guidance directs that coders should not report modifier -63 procedure performed on infants less than 4 kg with code 39503 repair, neonatal. Diaphragmatic hernia, with or without chest tube insertion and with or without creation of ventral hernia.